why do mental health issues and substance use issues tend to take root in adolescence? And why does it take us 8 years to treat them, to really identify them as an issue and take them seriously? That seems like such a missed opportunity. And so at the time, it was debated in the literature kind of which comes first. Is it that you are struggling with depressive symptoms, you're struggling with anxious symptoms, and so you self-medicate, right? You use substances to dull those feelings. So a self-medication pathway, the mental health struggles come first, and then come the substances, or the reverse. Adolescence is a time of boundary pushing and increased risk tolerance and exploration, and substance experimentation is a common scene in adolescence.
Hey friends, welcome to Public Health Careers. I'm Amari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Dr. Andra L. Wilkinson. Andra is a senior research scientist at Child Trends and an adjunct assistant professor at University of North Carolina, Gillings School of Global Public Health. She has over 15 years of experience in public health research and evaluation, with a focus on maternal and child health, behavioral health, and Medicaid. She conferred a Bachelor's of Arts in Integrative Physiology and a minor in Women and Gender Studies at University of Colorado at Boulder, then a Master's of Science in Public Health in Maternal and Child Health at UNC Chapel Hill, followed by a PhD in Maternal and Child Health at UNC Chapel Hill. In today's episode, you'll hear and learn more about what a career in applied research could look like for you, why maternal and child health is vital for overall community health, what's going on in the maternal and child health and behavioral health and youth development research space today, the importance of positive youth development for fostering youth resilience, why understanding the history and context of public health is just as important as building skill sets, and much, much more. Be sure to subscribe and enjoy today's episode.
Hi, this is Dr. Andra Wilkinson. I'm a public health scientist, and you're listening to Public Health Careers.
Andra, I'm super excited to chat with you. I knew our paths have crossed before, but looking forward to digging more into your story and learning about your experiences.
I'm excited too.
Awesome. So let's jump into things. How do you identify and tell us a little about your personal background?
Yeah, so I identify as a woman, a mother. I grew up in Colorado, lucky me, and now I'm in North Carolina, again, lucky me. I've been privileged to live in two beautiful states.
Absolutely. Where in Colorado did you grow up?
I grew up in Wheat Ridge and Arvada, went to school in Boulder.
Okay. Awesome. I'm actually heading out to Denver in a couple of weeks, so I'm looking forward to that.
Enjoy. Let me know if you want recommendations.
I will actually reach out to you about that. So thank
Please
you. Awesome. So jumping into sharing some of your expertise before we get more into your career journey.
Mm-hmm.
As you shared, you are a research scientist. You have expertise in maternal and child health. Your research focuses heavily on maternal and child health. What drew you to this area of public health?
I actually thought a lot about this question because my answer's really brief. It's vital. Maternal and child health is vital. If we don't have healthy moms and babies, what are we doing? I think it's such an indicator of the health of a community and the strength of its public systems, how moms and babies are doing, and youth.
And to that point, what are some of the most pressing challenges in the maternal and child health sphere today?
I was really sad to see that our maternal mortality rate has been rising every year for the past 20 years. It had a big jump in 2021. The pandemic likely contributed to that. But the most recent data shows that the disparities, the racial and ethnic disparities in maternal mortality, are getting worse, not better, in particular for Black birthing people and American Indian and Alaskan Native birthing people. And that is so disheartening because I know small armies of people working to improve equity in maternal health outcomes. To see that they're getting worse for two groups is really alarming. Combining that with the erasure of maternal health data, we're seeing a lot of key public health data indicators that we rely on go away at the federal level. I'm thinking about PRAMs. And at the state level, several states have dropped their maternal mortality review committees. And those committees, the people who sit on those committees are physicians, public health experts. They review maternal deaths that happened in a state and pore through the data to try to understand why. What can we learn from these tragedies? What could have been done to prevent these tragedies? So that states are abandoning those committees is really concerning at a time when disparities are worsening.
We are really at a, I don't know what the word is, maybe I'll say pivotal point right now, where I think there's a lot of changes that are happening and a lot of dismantling of things that we knew that were effective, and without knowing like really what is to come in like a logical sense. So yeah, it is very disheartening, but I am glad that I know so many people that are continuing to work towards maternal and child health equity, and to your point, like it is an indicator of a society of communities, like how we treat the moms and children and youth in our society is a real indicator of what our society values.
Yes.
It yes. No. So how can research be translated into policy to create better outcomes for mothers and children?
I love this question because I think research and policy, the research to policy pipeline can happen in several different ways, and it's really important, right? We want our policymakers standing on the shoulders of, oh, I'm going to edit that out, poor metaphor. We want policy informed by research, right? Research tells us about what works, what doesn't, what can be scaled cost effectively and quickly, and what can't. And that is the information that we definitely want infusing our policymakers when they're deciding what programs to fund or support or invest in. I think, if you'll indulge me, story, I think there's two big ways that I, as a researcher, have been able to inform policy. I say inform, not guide, right? I'm not advocating. I'm just trying to share the evidence base with policymakers. That's an important distinction. One way was as a student, I took a class in cost effectiveness analysis. It's a skill I knew I wanted to learn before I graduated. And the question that we tried to analyze the cost effectiveness of was postpartum depression screening. What if we had to make, in a cost effectiveness analysis, you make a ton of assumptions to make your model work. So we assumed, man, Medicaid ends, this was years ago, Medicaid ends 6 weeks postpartum. So that first postpartum visit, you've had a baby, you have your first visit postpartum with your provider. That is the visit at which you could get diagnosed with something like postpartum depression, and then you immediately lose access to health insurance. So you could get diagnosed with something and then have no means to seek treatment for that condition. So we thought, wouldn't it be nice if Medicaid lasted the full postpartum year, when we know a lot of things can go off the rails in the first postpartum year for the health of a mom and a baby. So what if Medicaid lasted the full year? What if all providers valued maternal health? That includes pediatricians, primary care providers, and OBGYNs. What if they were all trained in and supported screening? Would that be cost effective to train all those providers, all of the providers, adding that to the way they do provide medicine? And we found it was wildly cost effective. And that was a class project, right? But I thought, oh gosh, I want this published. So I asked the professor if she would publish it with me. We did. It is my most cited paper. I'm so very proud of it. And 5 years after that paper, Medicaid is extended to a year postpartum in 45 states and counting. Providers, tons and tons of providers, are screening for maternal depression. It's a whole conversation nationally. It's not nearly as stigmatized as it was. That can be so wonderfully fulfilling as a researcher when you see that your hard work was helped and supported that policy transition. but that took years, right? We know it takes a long time for policy to infuse practice. It can take decades even. There's also a much more direct way for policy to infuse research, and that is by talking to policymakers. There's a group that I've been a volunteer with for years, the Research to Policy Collaborative out of Penn, and they build relationships with offices, bicameral, bipartisan, state, federal. They talk to policymakers about what are the questions that are really important to your constituents, what's important to your community, what would you want to talk to a researcher about, and then they play matchmaker. And that has been incredibly fulfilling. I've gotten to talk to folks on the Hill, again, bicameral, bipartisan, talking to senators, representatives, Republicans, Democrats at the state and federal level. And that didn't take years. Those were brief conversations. And of course, I can't draw a line between what I said and what they did. But boy, does that make me a better scientist when I'm talking to folks talking to policymakers about what they're hearing from their constituents. That's not something I get to, I don't get a window into that often. So when I do, I think it makes me a better scientist.
Well, kudos to you, firstly. That is awesome to hear that you were
Thanks.
able to think about this research project, do it, publish it, and also speak to to policymakers and be a part of the change. And I think that is really the power that we can do when we are thinking about what are the issues that are important to me, and then what is the research that is important to kind of better inform how we can do things, and then advocating or creating more pathways for that. So that's really awesome.
Thanks. I agree. It's the power of public health.
100%. 100%. So switching over to another one of your expertise focuses, behavioral health and youth development,
Mm-hmm.
substance use and mental health, especially in adolescent health. What
Mm-hmm.
patterns or trends have you observed that concern or excite you the most?
I love that you asked about concern and excitement, because when we talk about youth, so often the tone can become really negative. Talking about all the bad outcomes, all of the risks, all of the problems, and not the ways in which youth are thriving or the ways in which youth are innovating and being brave. I think a trend that really excites me is mental health in general is so much less stigmatized among this generation of youth. And that is so exciting to see. I do some work on trying to support expansion of school-based behavioral health services. That's where youth are. Can we get them linked up to behavioral health services in school? And we're finding it's the adults in their lives that can carry more of the stigma. The youth are just talking about mental health, seeking mental health care to an extent I don't think we have ever seen in previous generations. And I think that is really exciting. I think a trend that concerns me is the youth overdose death rate. We were seeing a lot of patterns in youth substance use are going in the right direction, right? Alcohol use is going down. Tobacco use was going down. Then vaping came on the scene, and we see vaping really expanding in some concerning ways, right? We don't want tobacco use. Research is really clear on that. It's bad for human health. But then opioid use was fairly rare among adolescents for a long time, but I think fentanyl has really changed the game on that. Between 2019 and 2021, the youth overdose death rate increased by 182%. That's a big shift, and it showed really interesting geographic patterns. So the Maricopa County, which is Phoenix, Arizona, lost 120 youth in those 3 years to an overdose death. It was incredibly geographically concentrated. So that's really concerning. 120 youth in a single county over 3 years. And I think fentanyl has changed the game in youth overdoses because it has no discernible appearance, taste, smell. It can be pressed into pills. It can be put into a spray. It's a very nimble drug. It's very potent. There's no control over the potency, and it can kill you easily. That's really scary in terms of, in youth behavioral health, there's a real move that excites me of let's listen to youth, let's talk to youth, and less just say no and more, what are you seeing and hearing at school? What are you concerned about? What do you think is important when you're thinking about your health? Just more of a trusting conversational relationship. Then fentanyl comes on the scene, and it's really tempting to again go back to don't touch any pill ever. Don't accept anything from peers ever, because it could be fatal. So I think that's complicating how we talk with youth about substance use.
Well, thank you for sharing both what excites you and what is a little bit scary. It is awesome, and I do see that a lot. That there's just more broader conversations around mental health and about taking care of your mental health and what that looks like and seeking
Yep.
out different ways, just in the sphere of social media and in life these days. So I do definitely appreciate that. I also saw that Gen Zs are purchasing 30% less alcohol than millennials at the same age or something like that. So
Yep.
they're like different positives that are happening.
Mm-hmm.
And then to your point, how do we broach this conversation and continue to have it as a conversation where we're asking how are you doing? What's going on in your life, as opposed to just saying no and not making it a conversation, but just making it um I don't know what I'm looking for in the word, but everyone gets what I'm trying to say.
Mm-hmm.
And then I've also seen a lot of pushes around, as you're saying, that trauma informed approach and just how important it is, as well as a lot of the barriers that youth might face in mental health treatment might be their parents, and as well as the stigma of the older generations. And I feel like there's a lot that we need to continue to talk about and discuss more. But I appreciate you sharing those. And then in your research, were you going to share something?
Oh, I was just gonna say, something I'm hoping to see more of too is us talking about mental health and substance use in conjunction. That there's a lot of overlap in that Venn diagram, which is a segue to some of my research. And the systems that treat substance use disorder and mental health are pretty separate from each other, when their patients are more likely than not to be struggling with both. And so more integration there, I think, is something I'm hoping to see.
Appreciate you raising that up as well.
Yeah.
And in your research, how have gender and social determinants of health influenced substance use and mental health outcomes?
Yeah. So in my in my PhD for my dissertation, I was really interested in, when we're thinking about mental health and substance use, those things tend to rear their heads in adolescence, but we don't tend to treat them or identify them until well into young adulthood.
Mhm.
And so it seems like such a missed opportunity to understand, why do mental health issues and substance use issues tend to take root in adolescence? And why does it take us 8 years to treat them, to really identify them as an issue and take them seriously? That seems like such a missed opportunity. And so at the time, it was debated in the literature kind of which comes first. Is it that you are struggling with depressive symptoms, you're struggling with anxious symptoms, and so you self-medicate, right? You use substances to dull those feelings. So a self-medication pathway, the mental health struggles come first, and then come the substances, or the reverse. Adolescence is a time of boundary pushing and increased risk tolerance and exploration, and substance experimentation is a common scene in adolescence. And is it the substance experimentation that then causes conflict with your sense of self, conflict with parents, peer groups, education, your teachers, the consequences that can come from substance experimentation or substance dependence, and that compromises your mental health? And so, studying that association, I found gender played a really big role in terms of the self-medication pathway seems really common, especially among young men. boys, young men and boys, that the mental health concerns come first and substance use shortly follows. So it's of course not all the time, but it was a really strong pattern among young men and boys.
That is very fascinating. And I'm thinking about it from the lens of, like, I'm co-founder of Brothers in Public Health. And I think one of the things we're trying to do, probably not now, but in the future, is how do we like connect with youth and like just create ways to talk about these things, bring awareness to this, as well as like share public health as a pathway to making impact in your community.
Mm-hmm.
So that is very interesting, and I'll definitely have to look more into that. So I appreciate you raising that up. And then, like, what are the interventions that have shown most promise in supporting youth well-being and development?
So that's a big question. We could have a whole podcast on that. But something that shows a lot of promise is a focus on positive youth development. Like I mentioned before, we think of youth and we think all these negative things that we tend to say about any generation of youth. As a millennial, we were called lazy and entitled and all these negative things, which I don't think were true. And now Gen Z is being labeled with those. And so how do we interact with youth in a way that facilitates and supports the rapidly developing brain? Adolescence is complex and can be nuanced and fluid because it is the single biggest time of brain development, second to toddlerhood. So the two times when our brain is doing the most kind of pruning and reorganizing are the two stages of a child's development that we make fun of the most, right? We talk about the terrible twos and teenagers. And how do we have a more positive frame on that? Your sense of self is forming, your hormones are coming online in all sorts of interesting ways, your brain is rapidly changing, you're trying on new identities to get a sense of independence from the parent. Those aren't negative things, those are complex things. But how do we interact with youth in a positive way? So positive youth development approaches to education, to job training, to health and development, I think is tremendously exciting.
Yeah, that definitely is exciting, and I've seen more of like the asset-based framing of
Yeah,
conversations, and I think like that is definitely a part of how we are able to continue to have the conversation and like change the narrative around these things.
yeah.
So so what does public health mean to you?
Oh. Hmm. Public health is so deliciously broad. So to me personally, it means a sandbox in which I endlessly get to learn and play and meet new people and do interesting things. So that's what it means to me personally. The place I like, the sandbox I get to play in professionally, and I feel so lucky to do so. At a public level, at a society level, we know that 80% roughly of what affects our health and well-being happens outside of the doctor's office. And I think public health is a huge factor in that 80%. Public health is whether your community has sidewalks. Public health is the safety of your air and your water. Public health is your food systems, your emergency and disaster preparedness, your, goodness, the strength of your public systems. I mean, it is the elephant in the room for public health and well-being. And I think we spend so much time thinking about the individual and the medications that we're on and our individual behaviors, individual responsibility, individual patient-provider relationships. And I think public health forces that communal thinking beyond one patient at a time to thinking about the health of entire neighborhoods, counties, states, countries. I'm hopeful. The pandemic laid, I think, the pandemic laid bare how we have not invested in our public health systems as we should have, when you had public health departments still using fax machines to share data. I think we all benefit when public health is invested in.
Deliciously broad. Love, love
Right?
that.
For someone who's intellectually curious, it's deliciously broad.
That's a great way to phrase it. I'm gonna be using that some more. but I appreciate both like the personal perspective of public health being like the sandbox where you're able to have this deliciously broad like things that you can do or interests and ways that you can impact change, as well as how it's important for the communities, and the focus of community is just so important in the work that we're doing, whether that community is a neighborhood or a country.
Yep.
So shifting now to more of your academic pathway, before you became a researcher and did all of this research, you began your career getting a Bachelor's of Arts in Integrative Physiology at the University of Colorado at Boulder. What was your thought process choosing the field of study?
I was interested in science and math. I was interested in health. And in the university environment, that meant you had to be pre-med. So that long degree name means that I was pre-med.
And did you come in? So how do you land at integrative physiology as opposed to maybe like anatomy or biology or chemistry?
So the integrative University of Colorado at Boulder had 2 degrees that were in which you would get all the science and math that you would need to be qualified to apply to medical school.
Okay.
One was molecular and cellular biology. So if you really wanted to go into the details, benchtop science, cells, mitochondria, all that juicy stuff, you went that route. Because University of Colorado Boulder has a huge science program, so they had kind of 2 giant majors. I think they were the most popular majors in at the school. And so the second batch was integrative physiology, which was your anatomy, your epidemiology, your neuroscience. So thinking more about body systems and not at the cellular level.
Okay, makes sense. And while you were in undergrad, you participated in a social policy global leadership program for students at Charles University. Tell us about this experience.
Oh, that was cool. So that was a summer program through the Global Leadership Program. And it was students from all over the world. So students from, oh my goodness, Jamaica, Romania, Albania, Colombia, India, Pakistan. I know I'm forgetting. I mean, I'm going to forget some of the countries, and my friends will yell at me. But it was wonderfully and amazingly diverse. And we spent the summer in Prague, again, lucky us, beautiful city, talking about social policy and leadership. And that was fascinating. We're reading foundational texts in leadership like Machiavelli's work. And this young man, Bogdan from Kazakhstan, was like, yes, this is foundational leadership. This is what is right. And students from other countries, from democratic countries, Kazakhstan at the time was a monarchy, was like, oh, we have a really different understanding of how to structure public systems. And that was fabulous to be with students from all the world who had very different understandings of what public systems can and should be regarding social policy. That gets into a lot of, and public health can get in this too, of like, who deserves public support? You know, at what point do we set qualifications for things like Medicaid or SNAP or WIC? And so talking about that at a global scale was really fascinating. Who gets support from public systems and who doesn't? And how do we decide? And who decides?
That does seem like a very great like thought experiment. And like one of my favorite classes during my master's program was a class where we did comparative health systems and just like looking at how different health systems are set up, because it's just crazy like to think like so many systems are set up so differently, and then to the point of like what are the social policies that are aligned with those systems.
Yep.
How is the eligibility, and I feel like that's something we don't talk about a lot. I feel like just how eligibility can really create shift in dynamics for socioeconomics for people, and just how important that is. That's interesting.
Yeah. And what, benefits cliffs we create, and
Hmm.
how the different systems intersect. And I think that's where I swing back to maternal and child health. So many states now are creating like departments of early childhood or departments of children's health, which is so interesting to see it coming out of a Department of Education or a Department of Health. Or creating this new department. But I think it's really exciting. I've done some work with some of these states of how do we make our public systems cohesive, so that if a family is accessing childcare subsidy, they also get connected to WIC and Medicaid and TANF and Section 8. Why do we make families who we know are navigating all sorts of structural and racist barriers knock on 10 doors and go through 10 different arduous processes to get support?
Yeah, it truly is. It boggles my mind that we have created a system where the people that need the most support have to go through the most barriers and hurdles, and yeah, to try to like prove themselves worthy of that support, which is, yeah. Were
Yeah.
there any key takeaways that you had from your undergrad experience?
Yeah, I would say the world of work and the career paths you can take from undergrad is so much broader than your degree options. So I mentioned, I was interested in science and math. I was very much, pre-med was the only path that I could take. And I had no interest in being a physician. I learned that by the time I finished undergrad, that I wanted to talk about systems and
Mhm.
policy and data. I didn't want to talk about, individual health outcomes. And I'm so grateful that I didn't think, okay, I'm pre-med. That means I have to go to medical school. That means I have to be a physician. It's like, okay, I have a science degree. I learned a lot about science and math. I'm going to work in a public health system just to try it out and see, and found my calling. So I'd say don't limit yourself based on your degree. Think about it as you're training your brain, you're getting a perspective, you're learning a lot of skills, and then it's just going to get broader and more complex when you graduate. So don't try to set your lane in undergrad. This is my big takeaway. I'm really glad I didn't become a doctor.
Likewise.
Was
So
that part of your path too?
yes, I was pre-med as well, and failed to get into like Masters of Medical Sciences program, and got like Google ads for Masters of Public Health program, and then yeah, everything changed when I entered into the program and just learned more about systems and health inequities, and yeah,
Yep.
things I just didn't learn about in my biology pre-med degree, which is interesting.
Yeah.
Interesting, but hey, neither here nor there. You continued on to get your MSPH, Masters of Science in Public Health in Maternal and Child Health at the University of North Carolina at Chapel Hill. What
Mhm.
led you to pursue this? As well as you shared that you had that shift from pre-med to public health.
Mhm.
When did you learn about like public health as a field that you could work in?
Yeah, so I graduated amid the recession, the
Mm,
2008, 2009 economic recession. So layoffs were rampant. We were in an economic downturn. Not a lot of folks were hiring. And so a lot of my peers from undergrad ran to medical school. Like, I'm just
mm,
going to stay in education to avoid this terrible, terrible job market. But I knew that didn't feel like the right path for me. So I graduated and did all sorts of random odd jobs before I found a full-time job. I had to be scrappy and nimble. And I think young people today may have to as well, as we see what's happening in our current system. So I did data entry for a a maternal health researcher at the University of Colorado at Denver, and literally sitting on like an overturned bucket at a desk in their lab doing data entry. But I was like, I'm in a maternal health lab. All right, I've got a toe in the field. I worked for a group trying to find community leaders and fund them to do work to support the community, which was really, really neat, rather than a funder saying, here are my ideas, implement my ideas. They were trying to find in communities facing, navigating all sorts of inequities, who are the leaders with bright ideas of what could help and lift up and support this community, and funding them directly. I worked with them. I did a million little odd jobs. I worked night shifts in an emergency room doing registration. I'd done that night shift through undergrad. So I did a million little things and did a ton of informational interviews. So I bought coffee for anyone who would meet with me. If I read about someone and their job sounded cool, I emailed them and then asked them, who else do you think I should talk to? And I learned about Kaiser Permanente and thought, ooh, this is a cool health system, and that it is integrated, right? That the health system cares about public health because they're footing all the bills. They're the insurer and the provider. So they really care about the public's well-being of everyone they're insuring. I thought, ooh, that's interesting. I'm not seeing that in other health systems. I've worked in ERs for 5 years. I'm not seeing that care for the public well-being. And so I met, no joke, probably 17 people at Kaiser. If they were doing an event, I went to it. I just talked to anyone and everyone that I'm curious about this system. I want to work for this system. And the 17th person I talked to was like, well, we have an opening coming up. I mean, it requires a master's degree. You don't have one. It was in knowledge management. I had to Google what that was. But I read a lot about knowledge management. I prepared for that interview, and I am so very grateful to this day. That boss who hired me at Kaiser is my mentor to this day. And I'm so grateful that she took a chance on me, and I loved that job. And so for nearly 3 years, I worked for essentially Kaiser's kind of public health department. They did all kind of public health messaging campaigns, care coordination, employee wellness programs were all housed in this unit. And that's where just my mind was blown. I graduated thinking I have to be a doctor if I want to do science and talk about health. And that's at Kaiser's where I learned, oh my goodness, public health is a whole new world. It's thrilling. How do I do this? And so pivoted to pursue public health.
Well, I appreciate you sharing that story from bucket in lab to learning about public health in all that you can do. So and yeah, definitely makes a lot of sense in that event. So what were some of the most valuable takeaways from your master's program?
Yeah, I think let me look at my notes here. Oh, I didn't write it down. I think from my master's program, you'll hear a lot from students, and I'm adjunct faculty at University of North Carolina at Chapel Hill. So I hear from students that they're interested in building skills, right? They want to learn how to use R. They want to learn how to use Tableau and do data visualization. They want to learn skills. Learning the content or the history of a field like maternal and child health doesn't seem nearly as alluring as learning how to code in Python. And I get that, but what I love about a master's in public health is you get both. And it's really important to know the context and the history and the foundational understanding in your field. And being a public health professional, an MPH is a terminal degree or a public health professional. It's really important that you're well versed in what does Title V mean? What happened in 1996? You need to know that history. It's really important to be a coherent public health professional. So I think my takeaway is if you know how to code in R, but you don't know why we measure certain things the way we do, you have an incomplete set of skills. So that was my big takeaway from my master's program.
I love that. And I think that is very valuable for people right now. I think who are in schooling thinking about these things. I think we do speak a lot about, and I speak a lot about, build those skills that are so important. And I probably do forget to mention how important, like for me especially, because I knew nothing about public health before I got into my master's program, but just learning about the history of how these different systems were kind of built, and what was this act, and what happened there, and what was the ACA, and like how did that change things. Like just understanding the history of those things are so important for me, like in my job, in the work that I do with Public Health Millennial. And I think I appreciate you raising that up, because I think I don't hear that enough. So I'm glad that you kind of like centered me in, yes, it is like tangible skills, but you also need to have context and history, because especially in this field, I feel like history is very, very telling and helpful in as situations progress.
Yeah. Yeah. As a in my job as a scientist, I'm mentoring and supervising and managing folks with MPHs all the time. And the ones who get it, who understand the significance of this moment, the context that we're in, when we've seen periods like this before in history and what flowed from it, are invaluable. I can teach them to code. I can't teach them to get it.
Yeah, nothing else needs to be said there. So what else did you do as a, like in your role at Kaiser Permanente as a knowledge management and innovation specialist? What kinds of things did you do?
That was such a cool job. It's such a lofty title, but so I mentioned in that public health department, we had nurses, economists, um, like fitness coaches, theater majors that were doing like public health plays in schools. Like it was a really diverse group of professionals that had very different roles, but all of us together had the shared goal of the well-being of Kaiser's patients. And so knowledge management is really kind of the left hand knowing what the right hand is doing. How do we have enough documentation that I know where one department's work fits in with the broader goal? I know that there's not duplicating efforts. I know that there's not contradicting efforts. I know that we're having a consistent message. That's kind of the bread and butter of knowledge management. The innovation part of it was doing lit reviews to inform their innovation. If they were trying to do something different, doing a lit review to inform their action. And so one thing they noticed is mammography rates, so breast cancer screening, mammograms. Kaiser, because it's an integrated system, they knew who of their patients got their cancer screenings on time and who didn't. And they noticed really glaring racial and ethnic disparities in who got their cancer screenings and who didn't. And to their credit, they put a lot of effort and resources into that. And so the part of my role was to do a lit review what programs improve cancer screening rates for different racial and ethnic groups. Is it incentives? Is it messaging? Is it scheduling? Is it, they were like, we have nights and weekend hours. We're giving travel vouchers, bus passes. We're giving grocery store gift cards as an incentive. They were trying to do all that they knew to do. And so then it came to our department. And so the evidence at the time that I found was messaging really matters, of people understanding why they need to care when they're navigating a million other things. Why do they need to care about cancer screening? And let's be honest, mammograms are not fun. That's not a fun cancer screening. That is wildly uncomfortable and embarrassing cancer screening. So it makes sense people aren't lining up to do that, especially if they have a lot of other things going on. But if you help them understand why it's important in their community, if their community has a particularly high rate of breast cancer, that can be a really helpful thing to let them know to empower their own decision making. And so I went to the lit review, summarized it, reviewed it with the health communications team. We looked at the letter that went out, and it was a very form letter. It's important to prevent breast cancer, get your mammogram. We tailored it a bit more so it aligned with people's self-identified identities to talk about cancer rates in their community. And then we got to pilot it. And that was, I'll never forget that moment. I had done the lit review. We had tried different letters. We had done like focus groups to find the one that people liked the most. We had been edited and reviewed. And then in the health communications department, they like hit a button and that new letter went out to 10,000 members, which was so cool to be in the pipeline of know better, do better, and it being so short.
That is awesome to hear. And that really does sound like a cool position that you're able to and I feel like a title that people could also like look into and learn more about and use their public health skill sets around.
Mm-hmm.
So you continued on to get a PhD in maternal and child health at the University of North Carolina at Chapel Hill.
Mm-hmm.
Tell us about why did you pursue that, and what were some of your, well, you shared some of your research focus earlier. What were some of the most significant findings?
Yeah, so why the PhD was something I wrestled with for years. When I was working at Kaiser, I knew I wanted a public health career. I knew I wanted an MPH, but I also really like research. And so it was like, oh, do I want to work in a public health department or do I want to be doing research? And trying to just read as much as I could and talk with as many people as I could, kind of live my way into the answer, like what feels right and authentic. And because you can have a wonderful, resplendent career with an MPH. I was like, do I need to be in school for 5 to 7 more years, making $12,000 a year? You got to really want it to get the PhD. It's a lot of work. It's a big investment. But I realized that I wanted the methodological training and the skill set to answer my own questions. And that's really what the PhD gets you. And big takeaway in the research, we talked about that earlier, that we shouldn't pretend that mental health and substance use are completely independent of each other. We need to do a lot more engaging with young men and boys. They have some of the worst outcomes across the board. And we don't do a lot of programs focused on supporting and engaging young men in their health and well-being. They're like 6 times more likely to die by suicide. They're like women and men get equal prescriptions for opioids. Men are much more likely to end up struggling with addiction. They're much more likely to engage in violence compared to women. And we put a lot into boys will be boys. And that makes me really, I think we need to stop doing that. And we need to talk about the health of everyone. Public health cares about the health of everyone. That includes men and boys. And y'all aren't doing great. There's a lot going on.
Absolutely. I couldn't agree with that more. I didn't realize some of the statistics were so stark. Appreciate you raising up this issue. And I know there was a Netflix series. I watched the first episode, Adolescence. And I think it like digs into some of these kind of themes of like, we need to have better conversations with boys, and we need to like, I feel like there's a lack of like a lot of emotional intelligence in a lot of ways. And I don't know, I'm not going to shoot myself in the foot right now. I'll learn more about it and talk more about it in the future. But I think it is an important thing that we need to continue to talk about, like what it is to be a boy, what it is to be a man, what does masculinity look like, and like how does all of that tie to health outcomes, because we're clearly seeing some stark differences.
Yeah. And I will say, I think as a mom of a boy now, I was interested in the health of adolescent boys as a researcher, but now as a mom of a boy, I think we just have so much more room to grow in supporting the natural intuition and I think we create a lot of the lack of emotional intelligence. I think that's nurture, not nature. I'll say that.
And we leave that at there for now. More to come.
Yeah.
So how did your time as a pre-doctoral trainee at Carolina Population Center shape your approach to public health research?
That was awesome. The population centers are great because, and they're at several universities, not just at UNC. They are where folks study demography, which is basically births, deaths, and migration. But they tend to be really interdisciplinary. So the population center at UNC was so cool. I was talking with folks in anthropology, in epidemiology, biostatistics, statistics, economics, political science, geography, history, like people from all these different disciplines interested in migration, births and deaths, demography, how populations shift. And so that made my training much more robust and interdisciplinary, which really enriched it. The more you understand about, I think there's benefit in understanding other fields and where they intersect with yours.
Yeah, absolutely. And I think that is what we need to have, like, robust solutions that are effective in all the different realms. We can't be one-sided.
Right.
And I believe this was after your PhD, but correct me if I'm wrong. You were the project site manager for the poverty alleviation pilot in South Africa.
Mm-hmm.
Tell us about that. What was your experience leading that mixed method study and I think it was on youth employment in rural South Africa?
Yep. So that was during my master's. That was my master's project, basically. So we'll say for students considering public health training, make sure your program requires a practicum. I think that is so foundational. So when I was in my public health program for my master's, I was really curious about global health. I'd done mostly domestic health, but I thought, gosh, I just haven't even touched or explored global health. And I had done really quantitative training. I love math. I love numbers, but qual, I hadn't done anything in. So I thought, man, the practicum, being a student is so fun because you get little semesters to just try on something totally different. So like my practicum is such an opportunity for me I'll regret it if I never just try. And so I got an opportunity to lead the data collection for a study to look at youth employment in South Africa. South Africa has some of the highest youth unemployment. And so kudos to the professor who got this grant and thought, well, let's look at the youth. Some youth are employed. What did they do differently? A bunch of studies have said unemployment's really high. Well, tell us about employment. Who are the youth that got jobs? What are the industries that are hiring youth? So that was what I set out to do in Mpumalanga, South Africa, which is a rural northeast corner of the country. And it had a huge qualitative component, and it was global health. And I learned so much. I'm so glad I did it. And I learned I like quant and I like domestic health. So I tried two other things and realized these are very cool. Love that people love to do them. That's not my bag, and that's okay. I'm glad I learned that.
I love that. And I think that's important to share as well, because, it is about dipping your toe in and seeing if these things have, like, if there's a spark there, if there's more interest there, or realizing like, nope, this definitely is not what I wanted to do, and taking that step back. Those are important.
Yeah. And being a student is such the opportunity to you have that chance to try on a bunch of different things and see what feels right.
And did any of that role help you to influence your work in policy research and community engaged research?
Yeah. Looking back, it's always easy to draw the lines in hindsight.
Mm-hmm.
Moving forward, I'm sure it felt really random and just trying a bunch of different things. But in hindsight, I'm just like, oh, I see the the community engagement lens, I see that thread. I can pull it through. So, yeah, my work now, I'm doing a lot of community engaged research, which is just wonderful. I just love it. I just love it. Yeah, so it informed, I guess, to answer your question, when we were doing that study in South Africa, we were talking to the youth directly, and we were talking to the public policymakers trying to support youth employment. We were talking to the nonprofits that had, classes to help youth craft their resumes, that had internships for youth. And it seemed like, had we only talked to one of those groups, we would have missed it. Because the policymakers were saying, we're doing all these wonderful things. And you thought, oh gosh, why is unemployment so high? They're doing all these wonderful things. Then we talked to the nonprofits that are funded by these policies, and they're saying, we have these classes and youth don't show up. And then you talk to youth and they tell a very different story about why they don't show up and what the barriers are. And so I think there's value in science getting a little messier than it has historically. The real world isn't sterile. So the question of, like, in a lab, trying to isolate the exact factors, I think public health science benefits from being in the weeds, in community, messy, because that's where the root of it is. That's where we can get to what will really work and what changes are needed.
You alluded to your role before as adjunct assistant professor at UNC Gillings School of Public Health. What do you enjoy most about mentoring and teaching the next generation of public health professionals?
Learning. I think you as it's a way to stay young and keep your learning fresh when you're surrounded by people coming up at a time in public health that I didn't. I've been out of my public health training for 9 years. It's a very different climate now than it was when I was coming up. So hearing what is on their radar, what they're concerned about, what they see coming down the pipe makes me a better scientist. So that's my favorite thing. They keep me on my toes.
And your current role is a senior research scientist at Child Trends.
Mm-hmm.
You started off as a research scientist. How did you transition into Child Trends?
So when I was finishing my doctoral program, I had a sense that I didn't want to go into academia. I really liked applied research. I was less interested in what my questions were, like my intellectual curiosities were, and much more interested in what policymakers needed to know, what do programs need to know, what are their questions, what will help them be more effective. And so I knew I wanted to go into applied research. I looked at a bunch of different options, and non-academic research, we talk about it as if it's a monolith and it's a million different things. There were environments that looked and smelled and felt just like academia without the students, and I was like, not this. I'm glad the people that love this environment, but and there was places that were totally different. So suffice to say, to be more succinct, non-academic research means a million different things. I find it desperately exciting because there's a bunch of different ways to do it. And I was intrigued by Child Trends because they really cared that their scientists didn't stop at publishing peer-reviewed papers. They really care that reporters call us, that policymakers trust us, that we are connected to our audiences, that we're talking to physicians and executive directors and teachers and nurse practitioners. And they care that we're engaged with the systems we're trying to influence, which I think is fabulous and I think makes us better scientists. And so you'll pick up a theme, met as many people as I could at Child Trends, tried to get the people who I talked to introduce me to someone else. And Eventually, a position opened up. I applied. I traveled up to DC to do a job talk. The bus broke down on the way. Um, and yeah, was fortunate to be offered the job. And it's June 1st will be 9 years that I've been there. And I feel so fortunate to work for an organization that walks the talk of applied research.
That truly is amazing. And I'm glad that you're also like pointing out that, there's so many ways to use your PhD skill set, your doctoral skill set, and do applied research outside of like an academic situation. I think like more people are learning about those nowadays.
Mm-hmm.
So you were a research scientist, became research scientist to currently a senior research scientist.
Mm-hmm.
What did your work look like, and how has that evolved over time?
Yeah, so the research scientist position at Child Trends was designed for folks, fresh out of their PhDs. In that role, I was doing a lot of supporting more senior investigators on their grant and contract applications, their projects. I was a task lead, I was a project director, but I wasn't a principal investigator by and large. I won some small grants on my own as an investigator, but mostly I was partnered with other investigators, learning from them and supporting their work. And then over time, I took on more leadership roles and writing my own grants and mentoring and supporting more staff. And so the functions of it have stayed pretty consistent. I'm doing public health science and loving every minute of it. What has shifted is that I have more responsibility and leadership in that role.
And how did you develop yourself to be a leader or grow into a leader?
Oh, good question. That's a good question. I had the privilege in my undergraduate training to be in a leadership program and then participated in that program in Prague with leadership students from all over the world. I'm privileged to have received a lot of leadership training and education. And I think leadership doesn't mean you're the person with the most position power. It doesn't mean you're the boss. It means you are engaging to a higher degree. You're trying to think strategically. You're thinking further down the line. You're considering many complex, intersecting things. You're managing up. I think people who are exquisite at managing up, managing their bosses, trying to make sure the deliverables happen while their boss is juggling a million different things, are exhibiting leadership. It's just someone who's doing more than what they have to do. They're looking beyond, thinking broader, doing things that they don't have to do, but they want to do for the good of the group. It's a really broad definition of leadership, but so how I developed into a leader, trying my darndest, man, working my tail off, trying to learn from those around me, and being reflective, having a growth mindset. I think the best advice I ever got in my undergraduate leadership program, this was from a really seasoned executive, came and talked to us, and they said, when you're in a new environment, go in with the eyes of a beginner. And I think there's such wisdom in that, to not think, to sit in you don't know what you don't know, trying to live there. Things are so much broader and complex and nuanced than you could ever imagine. I'm learning constantly. Is it comfortable always? No. But that's what makes you a good scientist. That's what makes you a good public health person, is to be curious and learning and developing. And I think if you do that with a good attitude, you're likely to end up with leadership opportunities.
Appreciate that. And then shifting you to the past week's guest question, or the guest.
Oh, yeah. Oh, I love this question.
Yeah. Okay, so the question is, if you had unlimited resources, what's one major public health initiative you would launch today?
Oh, this question. So I wrote a paper in grad school. It was an implementation science course. How do we get innovations from research into practice? And from working at Kaiser Permanente, I knew that sometimes practice is innovating in ways that research isn't aware of. Research is slow generally, and practice has to be nimble and quick and adaptive. And so I wrote a paper about what if it goes the other way, that practice has innovations that researchers need to study and evaluate. Why is so much research driven by the intellectual curiosity of the privileged?
Mm.
Why more research should be driven by communities navigating very challenging circumstances. And so the thing I wrote about in my paper, and the professor did not like it. I'm sure it was sacrilegious to say to an academic, but what if research funding is tax dollars, right? NIH dollars is tax dollars. It's public funds, so the public should have a vote in how it's spent.
Mm-hmm.
So what if the NIH dollars go to community-based organizations? They decide what they need scientists for. They decide what is important to them. And then scientists kind of audition for the role of being their research partner. So they're setting the agenda, they're setting the objectives, the goals, they're choosing who they want to work with. That just makes more sense to me. And the professor was like, absolutely not. But I'm so tickled that is now part of my job. I got to work with a funder that did a community-based grant making initiative, and that was such a fun full circle moment for me. So my big initiative would be giving a lot of research dollars to community-based organizations and have them set the agenda.
I love that. I love that because it gives the power and the agency in the community to decide what's important to them and who they want to work with. Yeah, that is what we need more of, to be honest. That's what we need more of.
Agreed.
So moving on to the last section of the show, the Furious Five. Number one, what advice would you give to students trying to pursue a career in public health?
In this current climate, I think prepare to be scrappy, prepare to be nimble. The state of North Carolina yesterday announced $100 million shortfall from their public health department. There's going to be layoffs. It's a rough time to be going into public health, but we need you. Just prepare to be scrappy. I think a brief story, I finished my training and didn't learn a lot about data visualization. Like right after I graduated, Tableau and R and Polysimap were coming on the scene, and I want to learn about those things. So I was trying to convince and get those opportunities in my day job. I couldn't really make it work. And so I found a nonprofit. Shout out to You Can Vote. They're a nonpartisan voting rights group in North Carolina. And I said, could I help make some maps for you? And that would inform, I'll do it for free. That'll inform your outreach when you're trying to teach people about upcoming elections and engage them in voting. And they said, yes, please. And I got to learn Tableau. And yes, that was on my nights and weekends, but I was scrappy and gained a new skill, and that's benefited my career. So that would be my advice to public health students. It doesn't have to be dreary and bad. Sometimes it can be really fun and exciting.
Love that. +1 to all of that. Number two, if you are talking to someone wanting to get into your position, what advice would you give them?
Be curious, live in the you don't know what you don't know, and meet as many cool people as possible. I just treat it like Pokemon Go, and you're just trying to collect as many cool people in your network as possible. I think that is so informative. There's a million jobs you don't know what they are or how to get them. Expanding and investing in your network. I think connection and community and having a good network never goes out of style.
Number three, what's something you're working on improving right now?
Ooh. Having things that are just mine. As a full-time working mom, a lot of my day is work and parenting. So having something that's just mine. So I'm starting to paint again, which I haven't done since my adolescence, and I'm really liking it.
I love that. Number 4, professionally, do you recommend anything?
Oh gosh, for public health people, if you're not subscribed to your local epidemiologist, you're missing out. Caitlin Jetelina, thinking about the way we communicate data, the way we communicate and message public health, the way we interact with people who are suspicious and mistrusting, sometimes for very good reason, of public health. I think she's doing something really innovative. It's a space to watch.
+1 to that as well. One of my idols. Number 5, if there was one piece of advice you'd give your younger self, what would it be?
I think it's okay to not know. When you're young, we ask such lofty questions to the youth, like, what do you want to do when you grow up? It's like, in the current climate, like, millennials are likely to have 3 different careers over the course of our lives. Like, what a question. So I think we put so much burden on young people to have all the answers, which is a lot of pressure and really not contiguous with where they're at in their life. Instead, it would be like, what are you curious about? What are you excited about? Just, it's okay to not know.
Absolutely. Andra, thank you so much for coming on and sharing your wisdom of knowledge. It was really fun to get to know more about you and your story and your experiences, and I feel like you dropped a lot of great information for people listening.
Thanks for the opportunity, Omari.
Truly, truly is my pleasure. Housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a like, leave a review, and share it with a friend. They will definitely get some value from it. Thank you all. See you all next week.